Alcohol is the most commonly used addictive substance in the U.S., with almost 18 million people suffering from abuse or dependence. It can be obviously extremely difficult to treat. So there's a treatment method, and this treatment method suggests that alcoholics can actually drink themselves sober by taking a drug called Naltrexone while they drink. But the question is this safe? And you may all have heard us talking about Naltrexone before, because that is a reversal agent for opiate abuse. And so, for instance, if someone comes to the ER and they've overdosed on heroin, Naltrexone can help reverse the effects of that. But this is something somewhat new. We're joined now via Skype by board-certified psychiatrist Dr. Domenick Sportelli. And we also in the audience have psychologist and addiction expert Dr. Jaffe, who have a couple of different perspectives on this. But Dr. Sportelli, first things first, just explain to us how Naltrexone can work in this circumstance in terms of, we think of it as a reversal agent for opiates, but how can it be used in terms of alcohol?
When someone drinks alcohol, not only do you get drunk, but you have a euphoric experience. And the euphoric experience is based on what's called endogenous opiates. These are opiates that we produce in our brain. So the thought is, if we can block those opiates in our own brain, we can block that euphoric experience, and therefore getting drunk won't be as pleasurable as it used to be.
Dr. Jaffe, I want to go to you really quickly, because you're saying Naltrexone, this method can be used effectively. It's something you would take before drinking if you were, say, an alcoholic. Obviously, the first reaction is, oh my gosh, we're sitting here saying alcoholic, take a drink, and it's difficult to conceive.
It is, and a lot of people feel that if you're going to take care of any alcohol problem, you have to be willing to quit forever. That's sort of a commitment you have to make on the front end. The Sinclair method, which is what you're talking about, is actually a very different method, which is you actually can continue drinking, but as a psychiatrist pointed out, what you end up doing is you take Naltrexone about an hour or so before you drink, and what it does is it slowly tears away the pleasure effect, as you talked about it, the reward from the experience of drinking. What people report when it works for them is they just don't want to drink as much. If alcohol causes problems in your life, Naltrexone is a great medication to try out. The main problem is only 1 out of 10 people who have alcohol problems actually end up going into treatment. So I think the great thing about this is something you can try relatively easily with a prescription, a therapist, or a psychologist who knows what they're doing.
And that's why we're talking about this, because I think over and over again this year we've discussed how 10% of people who have a dependence or an addiction to drugs or alcohol seek treatment.